At this point, it suggests that if you need blood pressure medication to control it, that it's better to take it than not to take it. Of course, the best thing is if one can control the blood pressure by changing the lifestyle. This is possible in a large number of people, but it's not very possible in the majority of people with high blood pressure. If they need to take blood pressure control medicine, they should take it. At one point, what we worried the most with high blood pressure was the risk of stroke. And we still worried the most about that, because for the average American, a stroke is worse than death. There have been several studies in which there was a pretty good documentation that Americans in average fear much more being paralyzed and being unable to carry on their daily activities than actually dying. So the stroke was and remains a sort of a very scary outcome, so to speak. Now, stroke, the incidence of stroke has been declining in this country, fortunately, and we think in large part because of the attention to blood pressure. But high blood pressure also causes heart disease, heart attacks, and death, sudden death. The other outcome that is very that we would like to avoid is kidney disease, because that also impairs one's ability to carry on their lives in a major way. Now we are also very interested on the possibility that high blood pressure could also lead to dementia, even outside causing a definite stroke. So even in patients who have not had a clinical well-defined stroke, a high blood pressure may lead through other alterations to cognitive dysfunction. So high blood pressure is one of the main risk factors that we need to address in this country. Yes, that's the first step. If one can't fix high blood pressure, if it's resistant to treatment, if you know you've been exposed to high blood pressure for a long time, then imaging is very important to assess whether you've had already damage to your body because of high blood pressure. That damage is generally in the heart, is generally an increase in thickness of the heart. It's just like, if you carry things for professional purposes, the muscles become hypertrophied. So if your heart has to pump against a high blood pressure, it becomes hypertrophied the same way. So it becomes thicker. So thickness of the heart, also brain alterations that are initial brain alterations by imaging are suggestive of exposure to blood pressure for a long period of time. And of course, kidney function also is something that that one can assess, not by imaging necessarily, but by metabolic measurements of kidney function to understand if exposure to blood pressure is already damaging the kidneys.